Well, hello, everybody. Welcome back to the St. Clair County Health Department's Facebook Live. We've been doing this for a number of years now to give you updates on your COVID situation. And then now that the COVID is at a lower risk, we've brought in special guests today. We have a very special guest to talk about our community's health. So let's get right to the COVID update, and then we can get to our guest. This is the number of new cases we've had in the past week. I will remind everyone that this is the cases that we are aware of. Most estimates are that the actual cases are anywhere from 3 to 4 times this number. So still a substantial amount of COVID transmission, but and 2 new deaths. But of course, we see that our current risk level is low, and that's because the CDC risk levels are really weighed heavily on impacts on our healthcare system and our hospitalizations. And we are not seeing that level of hospitalizations that we did with our other variants. So this is good news. Let's go to our next slide. We're going to show the country and our state. And you can see there's a wide variability of who's in low, medium, and risk categories, high risk categories. We went from high risk right back down to low risk. And again, that's because of our hospitalization status, not because of our cases. I just want to mention that regardless of what the community you live in, what risk level it's in, if there's transmission and you are vulnerable, you're immunocompromised, you're unvaccinated, you have other chronic health risks, you should still be cautious, wear masks when in indoor crowded places, and please consider getting a booster, particularly this summer before the fall season begins. So that's our update on COVID. Of course, we'll take any of your live questions. But while we're waiting on those, I want to get straight to our special guest because we have a lot of really interesting information for you. I want to introduce Dr. Martin Hill. He is the president of VIP Research and the main researcher that helped us with this most recent community health assessment. Hello, Marty.
Hello, Dr. Mercatante. Thank you for inviting me to be a part of this. I'm really excited.
So I'll just start, before you start your questions, Jennifer, I'll just start by phrasing this. Every 5 years, and these are done traditionally every 3 to 5 years, our county does a community health needs assessment that's very comprehensive. This is our second comprehensive health assessment. We used Dr. Hill last time as well, so there's a great deal of consistency. And this information is so valuable to help guide us with future decision-making interventions and to give us a really good insight into where we're healthy and where we're not, and where we can make improvements. That community health needs assessment is now posted on our website in its entirety. So I want to make sure that you guys know you can go and look at that. So Jennifer, go ahead and start your questions.
All right, good afternoon, Dr. Mercantante. Good afternoon, Dr. Hill. So I will just ask you some questions back and forth, and then we'll take live questions from the audience if there are any on this as well. All right, Dr. Hill, could you tell us a little bit about yourself and your professional experience?
Sure. So my name is Martin Hill. I have a Ph.D. in sociology, and my area of concentrations were medical sociology and applied research and evaluation. So I've done a lot of research, over 35 years worth of research in social science, but in the area of medical and health and illness in particular. And I've been doing the community health needs assessments for about a little over 12 years now. It all started like right when the IRS mandated that hospitals in particular needed to do these every 3 years.
And I'll just chime in. When we were looking to do this process in a robust way, we looked around the state and said, well, who has done a really good community health assessment? And by the way, who's the healthiest community in the state? And the one that comes up always is Ottawa County. They're always ranked number 1 or number 2 in health. So we thought, why don't we see who Ottawa County used? And of course, it was Dr. Hill. And so we went from there. So you came well researched. Go ahead.
Thank you.
So
yeah, go ahead. I'm sorry.
No problem. Dr. Hill, what is the Community Health Needs Assessment, or CHNA as we normally call it? How could you describe that a little bit more for the audience?
Yeah, I'll just back a little bit off of what Dr. Mercantante said. It's really it's research where you want to uncover the community's health status in terms of their needs, issues, any gaps in services. You want to identify assets as well and resources, and you really want this information to lead to implementation of strategies and services where you can address any of those needs and especially health disparities in your community. And typically, I'll just go into, what is it specifically. You're basically you're collecting primary data in many forms. And what we do is we collect it in four different forms. Um, Most notably, we do a behavioral risk factor survey with residents in the community. And this time we did 1,000 of those. And that was done via telephone, both cell and landline. Additionally, we did in-depth interviews with what we consider to be key stakeholders, and these are the people with a 50,000-foot view of the health and healthcare climate of a community, people such as hospital administrators, clinic directors, etc. Then we did an online survey with key informants, and these are clinicians, nurses, PAs, dentists, people, with hands-on experience. They're in the trenches dealing with health and healthcare issues every day. And then finally, with the primary data, we also focused on underserved residents, and we really wanted to get their feedback. So we focused on the underinsured, the uninsured, I would say single mothers with children, elderly, and in some cases minorities or migrant populations. And then we combine that with secondary data that we pull from sites like Census, CDC, things like mortality rates, and infant and adult and life expectancy rates and things like that. And then we kind of roll it up into a story of the health and healthcare climate of a region. So I think by getting all of that feedback, we really strengthen our conclusions in terms of how the community is doing with regard to
And
health.
I want to emphasize, it sounds like a lot of work, and it is, but it's also really important to emphasize that Dr. Hill and his team know how to do this in a way that is accurate, or as accurate as you can be, and that the information is in fact what we call generalizable to the rest of the community. So the information we have, we feel fairly secure, can say this is really a true picture of our community. They use validated tools. There are right and wrong ways of collecting this data, and Dr. Hill and his team definitely know the right ways to do that. So I just want to make a point. This isn't just like you go door to door knocking, asking questions. There's very
Right.
precise, validated tools to collect this. So,
Well,
And
especially with regard to the behavioral risk factor survey, we follow the same protocols the CDC does for the state and the nation. And that's the best way to try and get a most, a sample that's proportionate to the population in general.
and these
and
are
also
evidence-based
because of
practices, right?
Mm-hmm. Yes.
right, so also by doing it in the same a statistical method with the same methodology that's used
Same
by other,
sampling.
you can
Yeah.
you can then more accurately compare. So we're asking the same questions in the same ways. So we have national and state data, and with our questions being done in the same methodology, same questions, we can then compare them to how we like align with the rest of the country, which is also a very important tool, right? Where are we in the whole pack of things?
In which we did that in the report. We compared to the state and the nation on key measures, but you can also compare to other counties that use the same protocol.
So, Dr. Hill, you worked with us in our last CHNA. So, Dr. Mercatante, you might want to chime in too, or maybe you want to take this question, but how is this CHNA different from the one that we did in 2016? I know there were some different things we collected this time.
You can take
Yeah,
that one.
sure. Well, specifically with regard to questions, obviously there were questions about COVID in terms of what people knew, how it impacted their life, whether or not they were getting vaccinated. Um, but also this time we asked ACEs questions, which are adverse childhood experiences questions of adults, asking them about things they've experienced in their childhood. That's a measure we can also use to compare to the state and the nation. And the information we found from that is really, really important and impactful because it shows you that there's a direct relationship in terms of people experiencing negative or adverse childhood experiences in childhood and the outcomes they will experience in life as an adult. But I think a general difference I want to make is that we did collect this data, last year in 2021. So that's a COVID year. And so some of the measures we look at might be a little bit different than they were in 2016 because of that. But I think it's important to collect that data during a COVID time. You can use that as a baseline. And the results are similar in a lot of ways to Ottawa counties, which we collected in 2020, right in the thick of COVID, the summer of 2020.
So
So
we had been
those are
talking
just some
about
of the differences.
Yeah, we have been talking about how in a worldwide pandemic, stress levels may be elevated. People may perceive their environment or their health in a more pessimistic way, and we
Right.
certainly did see a reduction, and we can talk about that a little bit. But we did see a reduction in people's self-reporting of their overall health and their well-being. And is that because of COVID, or is that because people's health is really starting to continue to decline? And that's a decision or a discussion we have to have community wide as we move forward.
So how does this CHNA compare to others, and are there specific similarities or differences?
I think what she means here too, because you do
Other counties.
CHNAs throughout the nation, I understand. And so, how does ours compare when you look at our results with other communities?
Well, it's interesting because when I look at the results of the key measures, um, I'll talk about the positive first. St. Clair County did very well in terms of like healthcare access. Three things I'll mention, but there's many more in the report. But for time, with limited time here, I'll just discuss three. So healthcare access. So in other words, more people had health insurance. They had more people had their PCP. More people were confident in navigating in the healthcare system, and there were fewer people foregoing health due to cost than people across Michigan or the U.S. And all these measures were also better than they were in 2016. Also, I think St. Clair County does very well in terms of clinical preventive practices. Their screenings for cancer in terms of mammogram, pap smear, colonoscopies, things like that are all better than the state or the nation. And then finally, a pleasant surprise was, although mental health numbers were down a little bit and not as good as the state or nation in terms of people who report poor mental health or report psychological distress, what I was pleasantly surprised seeing was that the proportion who are classified as having either one of those, that are either taking medication or treatment for those conditions, was better than the state or the nation, and also improved from 2016, and also is on par with someone like someplace like Ottawa County, which is considered to be the healthiest county in the state. So I'll talk about that in terms of positive things. Do you want to say anything, Dr. Mercatante?
Well, I'll just say that those two indicators, I think you can directly relate when you talk about uh, health outcomes and when we measure things. Both of those things can possibly be explained by changes in policy. So, of course, we had Medicaid expansion statewide,
Right.
which has allowed more people to be insured. And through COVID, of course, people falling off of Medicaid was temporarily halted. So even people who might have fallen off Medicaid, they were kept on the roster. So that's one. And then the other thing is, I know our community mental health has worked very hard to expand their access. They've pursued grants and other things to expand their mental health treatment access. And even though I know we still have a long way to go, I think it illustrates that applying your resources to areas that have a particular need, you can see improvements in a relatively short period of time.
Right. And as
All
far
right.
as
Go ahead.
things that I don't know, areas of opportunity or opportunity for
Yeah,
improvement.
that's what I was going to
Um,
ask you next.
yeah, St. Clair County doesn't do as well as the state or the nation in terms of people who report their general health as fair or poor, people who report their physical health as poor, people who report their mental health as poor, um, the chronic conditions, all of them that were measured, whether it was asthma, cancer, heart disease, arthritis, diabetes, all, you know, not as good as the state or the nation. And also, interestingly, when I talk about not as good as the state or nation, that's also pretty consistent with how they would line up with Ottawa County. If they're not as good as the state or the nation, they're not as good compared to Ottawa County. If they're better than the state or the nation in terms of like healthcare access we were just talking about, then they were generally better than Ottawa County even. Um, Risk behaviors too. There's issues there with smoking, binge drinking, vaping, consumption of fruits and vegetables. Although that last item, consumption of fruits and vegetables, that's pretty much an issue across the board, across regions, across demographics, that people don't eat enough fruits and vegetables. I would say another issue that I think was a key finding is in terms of teen depression, worse than the state or the nation and up from 2016. Also, suicidal thoughts and attempts for teens or young adults, also compared to the state or nation, worse. And I would say that's what I would point out as far as negative things. But then I have some other general key findings. um, we'll talk a little bit about ACEs, maybe a little bit, but we talked a little bit about it being an important thing that we measured, but we know that that these adverse childhood experiences impact adults in life in terms of the outcomes. But what's interesting is that very few key informants confirm that they screen patients or clients for adverse childhood experiences clinically. So I think that's an area where we could see some improvement. Another thing we uncovered is that we looked at social support and resiliency, and both of those things that are kind of interconnected are very important in terms of being correlated with negative outcomes in adulthood. And then finally, we have a nice section in the executive summary where we talk about health disparities. And one of the biggest disparities is, there's a direct relationship in terms of experiencing negative outcomes in adulthood. It's indirect in terms of comparing it to education or income, meaning those that have higher incomes or have more education are going to be less likely to engage in risk behaviors, not alcohol, but things like smoking. And they're going to report better health physically and mentally, among other things. And then we also pointed out some other disparities in terms of gender and age. But I think the connection between education and income is the strongest, because not only is it a direct linear relationship, it if you isolate the people in the lowest groups of those, the people with the lowest incomes and the lowest education, they are by far significantly more likely to experience the worst outcomes, um,
Mhm.
as reported in the behavioral risk factor survey.
Which is why a lot of our public health interventions are focused on more of the vulnerable, what we call vulnerable community minorities, or those that have are income challenged, you might say, or education challenged. Do you mention, Marty, the fact that our obesity rates increased significantly as well? I don't know if you did, but I think that's an
Yeah,
important factor, and that's probably true throughout the state. Am I correct? Through the pandemic.
uh, it, it's well, yeah. I mean, that's one of those issues like consuming fruits and vegetables. Obesity is a problem in many counties, but the obesity rate in St. Clair is higher than it is in Ottawa County. But in Ottawa County, it's still going to be a third or two-thirds of people are going to be overweight and or obese.
Mhm.
So it's universally an issue.
So I'll
But
just go
it's
back to disparities. The disparity of overweight, obesity, again, varies a lot by demographics or age, income bracket. The ACEs, people reporting 4 or more adverse childhood experiences, was very dramatic to me. The difference, not even so much about income or education, but with ethnicity. The racial differences of people reporting adverse childhood experiences is pretty profound. And then I guess I wanted to touch on before we go on our mortality rates, because this is something we uncovered in our last CHNA, and it appears to be a persistent problem. You want to talk a little bit about that, Dr. Hill?
About the mortality rates?
Mm-hmm.
Well,
Or I can.
I think the infant mortality rate was actually a little bit better this time around, but the adult and child mortality rates
Actually, the
were.
opposite. So our infant mortality rate is elevated now, where last time it was on par. Our child mortality rate's on par, but our adult mortality rates were elevated in 16 and remain elevated. And what's a little different, maybe talk about being worse, is in our 2016 health assessment. Although our mortality rates were higher, our incidence of chronic disease was about on par with other communities like ours. This time around, we are seeing more disease, more diabetes, more heart disease, although asthma and COPD have actually fallen. So we have not seen an improvement in our health or our health outcomes, being, of course, death being the worst health outcome you can probably identify, despite the fact that we've improved our healthcare access. And I think, to me, that brings out the importance of social determinants of health. The things that we don't really talk about when we talk about health care, but things like transportation and the quality of the environment people live in. We talk about education and income. What are the economic opportunities? Racism and other traumas that occur with our minority population. So I think these are issues that, to me, as this community moves forward, has to pay particular attention to, because to move that dial a little bit, we're going to have to pay attention to social determinants a little bit more.
Yeah,
And
and
did
one thing
you?
I would just add too is you have to be a little careful when we do pull the secondary data. We have to realize that it's going to be a couple of years behind the primary data we're collecting. So when we're looking at like the behavioral risk factor survey data that we're collecting in real time, just when we're also talking about mortality rates, just keep in mind that those are reported from about 2 years prior to that.
Correct.
Dr.
Yeah.
Mercantante, I know also you wanted to point out some of the key findings we found about COVID.
Yeah, I thought the COVID data was very interesting. And of course, I'll be the first to say we took a lot of heat for some of our COVID mitigation strategies. And what we did find is that the vast majority of people, 80% or more, followed COVID mitigation strategies, masks and social distancing. And roughly that percentage believed that they had a positive impact. So that was very reassuring. People self-reported receiving at least one COVID vaccine, quite honestly, in excess of what we know to be true. So I think people overrepresent their uptake of COVID. I think probably most importantly is the overall impact from COVID. When we asked about did it negatively impact your life, for the overall community, about a third of the population said it negatively impacted their life in some way. But when we surveyed our underserved population, the population that's most at risk, people who have less income, whatever, they reported double that amount. Over 60% of them experienced negative impacts from the COVID, which tells us that COVID and really many of the things that impact our lives negatively are not equally shared across the community. There's, again, we call it a disproportionate impact on some of these things on people who are more vulnerable. And so, when you talk to people, say, well, COVID's no big deal. Nothing happened to me. There are a lot of people out there who have had very different experiences, and we have to keep that in mind.
Can I ask you a
Doc,
question? So what do you
Oh,
think the
go ahead.
true proportion of people who are vaccinated for COVID are in St. Clair County? Because you said it
So
was
we
kind of
have
inflated.
Right. Well, so, again, they're reporting at least one, but we know that about 52% of our population is fully vaccinated. I think that your report suggested over 60% that they had some kind
Right.
of vaccination, but at least one vaccine. Oh, if you can look that up really quick, adults who have had at least one. And of course, if you break it down into adults versus teens and adolescents, young adults, and then pediatrics, the number goes substantially down. And when you include people maybe who've had a booster dose, then it goes down below 50%.
Well, one
So,
thing I wanted to mention is what's interesting is we also asked in the survey, what are your top three most trusted sources of health information? And it's doctors, CDC, local health officials. Those are the top three. So that kind of shows you how this issue became politicized a little bit, I think,
mhm,
because those are their most trusted sources of information they're telling us. Um, but yet half to a third are not getting the vaccine for it.
right. So, go ahead,
We have
Jen.
about 5 minutes left, Doc. You have to be off by 4, correct?
Correct.
Okay, so Marty, Dr. Hill, excuse me. I don't know if you want to talk about really quickly about a growing number of people are considered to be part of the ALICE population. Do you want to explain that?
Yeah, well, the Alice population is a group. I think that's a group that's most affected because these are people with limited assets, but they're employed. So they're usually, quote unquote, between a rock and a hard place. They're working, but they're not making enough to either they're working part time, so their job doesn't come with health insurance, or their job doesn't offer health insurance, or it's not quality health insurance. But yet they make too much money. They're not eligible for Medicaid. So this is usually, and that's just healthcare, but they also go without other services because they have a hard time making ends meet, but they're working. And so they're thinking about things like, can I afford my rent? Not, should I go to the dentist? So a lot of times those preventative measures go by the wayside because they're worried about meeting their basic needs.
Right.
Yeah, and we
Okay,
see an
thank you.
impact on young parents with that as well. I could share with you guys a couple of tragic stories in our community of young single parents who are working, kind of fall out of that range of having social service available to them, childcare, things like that, and therefore they have a much more difficult time doing things. So, Dr. Hill, I want to thank you very much for your work.
Sure.
It's been a pleasure working with you. And I'm going to take these last few minutes to just share with this audience my gratefulness and my thanks for tuning in and paying attention to what we believe and hope has been the best information that we've been able to provide. I know it's been a challenging couple years and things have changed rapidly, but myself and my team have worked very hard to bring you the very best every time we're out here. And we want to thank you for tuning in. This will be my last broadcast. I'll be moving on. And I just want to, again, thank everyone and urge everyone to just remember we're coming through this, what I hope will be the worst phase of our pandemic. The virus is not gone. We're going to be dealing with this for a long time. But I think the worst is behind us. And what we have to do now is just use our heads and our senses. Take stock of where you are right now after the last couple of years. If you're like me and you haven't moved behind your desk for a while, start a walking program. Reach out and talk to somebody you've lost touch with. Join a group that gives you pleasure and makes you feel like you have a purpose. Do some things that help you come through this. Now that we're on the other side, we have to rebuild and we have to recover. We're in a recovery phase, both as a community and also as individuals. So I just urge you all to keep working on that and just stay healthy. If you hear something that doesn't seem quite right, look for it in another source. And I can just guarantee you that we'll continue to always give you the best information we possibly can.
And Dr.
And on that,
Mercantante,
anything else?
I just want to personally thank you because we've been doing this together, this Facebook Live. It was weekly. It's been monthly lately, but thank you. It's been a pleasure to work with you, and thank you for giving your time to the community to answer all of these questions because I know it's not easy, but you are always going to be number one A class to me. So thank you.
It's been my honor. It's my honor and my pleasure to serve you all. God bless.